And hello friends, myself Dr. Sonali and welcome to my channel called MedRecall. Today we are going to learn about osteology. In this chapter we are going to see the long bone, its structure, cells and many other things regarding bones. Then let's begin it with a positive thought. It is believe you can and you are halfway there. If you believe that you can do it, then your half of the work is done already. Okay, so have a positive life approach. Osteology is study of bones. In this topic we are going to see what is long bone, its classification and how it is structurally divided. So the long bone, you can see the structure of long bone. This is the end side is epiphysis, this one epiphysis end side, and the middle one which is shaft is called as diaphysis. Okay, so epiphysis present at ends, E for epiphysis, E for ends. They are more than one in number. They are derived from secondary ossification center and they appears after birth. These are important MCQ points. Okay, epiphysis, E for epiphysis, E for ends. They are more than one in number because they are present at ends and there are more than one end. Okay, two end points are there. So two ends, secondary ossification center. Two for secondary, two for two end. Let's see what is diaphysis. So diaphysis is present at the shaft. It is one in number. Okay, diaphysis is one in number. It is derived from primary ossification center. It is present from 6 to 8 weeks of intrauterine life. So remember, diaphysis जो है, it is present since you are inside your mother's womb. Okay, so diaphysis is one in number and it is derived from primary ossification center. One for primary, one for one in number. That is, diaphysis is one only, na. Then comes to metaphysis. Metaphysis is present at epiphyseal end of diaphysis. Okay, this is metaphysis which is present at the epiphyseal end of diaphysis and it appears at growth plate. Means metaphysis replaces growth plate. Let's understand what are cancellous bone or spongy bone. So cancellous bones are also known as spongy bone. They are present at ends and near bone marrow. Okay, so means epiphyseal ends जो होते हैं, they are mostly cancellous or spongy. Then what is compact or cortical bone? Compact or cortical bones are present at shaft. So diaphyseal जो diaphysis होता है, that is mostly cortical or compact bone. Now let's understand what is bone ossification. So students, so friends, listen. Bone ossification can be endochondral or membranous. Okay, and most of the bones undergo endochondral ossification. Means it is before ossifying, it was a hyaline cartilage model. For example, skull base, which later on undergoes endochondral ossification to form a compact bone. What is membranous ossification? So only few bones undergo membranous ossifications. They are clavicle bone and few skull bones. Okay, clavicle is partly membranous bone. Let's understand this line diagram which is representing primary and secondary ossification. First, it is primary center of ossification. Suppose it is a shaft and then there is primary ossification center in the middle of the shaft. It is the timeline is 6 to 8 weeks intrauterine life. And then it changes into diaphysis, which is called shaft. Okay, it is inside the womb of the mother. Okay, once the baby is born, that is after birth, the secondary ossification center start to appear at the end. Okay, this is growth plate. Okay, which will get replaced by metaphysis. Okay, growth plate is nothing but persistent hyaline cartilage. And then after metaphysis, there is epiphysis at the ends, and these epiphyses have secondary ossification center which appears after birth. Then in this and the final diagram, you can see the diaphysis which was already present inside the womb, and then metaphysis has taken place of growth plate, and then epiphysis which has appeared after birth. And then there is one another thing, which is articular cartilage. The name itself tells it attaches the bones with something, na. Some hyaline cartilage persist as articular cartilage at ends which never ossify. And the important point to remember that these articular cartilage will never ossify. Okay, all we know that everything the within intrauterine life also it was cartilage only, it was hyaline cartilage model only, but it later on ossifies. The epiphysis also ossifies because the secondary ossification center develops after birth, but they ossify somehow. But even the metaphysis, which was growth plate before, it get ossified. But the articular cartilage will never ossify, and it makes ends of bone smooth. That is why the ends of the bones are smooth. It facilitates smooth movements at synovial joint. And the another thing which is clinical based, it undergoes osteoarthritis. You will know, as we age we undergo osteoarthritis in many of the patients in orthopedic OPD. You can see they undergo osteoarthritis during aging and they do not have perichondrium. Okay, so what is the cartilage which undergoes osteoarthritis in future? It is articular cartilage. Let's see the basic structure, the basic histology of compact bone. Okay, if we are taking the cross section, then see there is periosteum, the outermost layer. Okay, the pink color, this purple color will be the periosteum, outer layer, which is made up of collagen fibers. Okay, then on external surface, it is present on external surface, perichondrium is present towards it, whereas perichondrium is present towards it. Okay, perichondrium means the cartilage, perichondrium means cartilage ka external layer. Then endosteum, endosteum will be the inside lining of the bone marrow, cells are present towards it. So endosteum, endosteum will be within endosteum, this green colored layer is endosteum. Okay, it is inside layer, inside lining of the bone marrow. Haversian canal, so there are canal system inside the bone. There are two types of canals, one is Haversian canal and the other one is Volkmann canal. Okay, Haversian canal, you can see in the center of each lamella there are lamella. First of all, listen, first of all there is remember this one cylindrical portion is called as osteon. Okay, also known as Haversian system, which is composed of many lamellas. These concentric ring like structures are nothing but lamellas, and inside the lamellas there is one canal which is called as Haversian canal. And when many of these Haversian canal has intermittent internal lining, these are there are some system which joins these canals also in between, it is called as Volkmann canal. So Volkmann canal connect Haversian canals. Okay, and what is the role of these canals? So these canals contain neurovascular bundles. So okay, so neurovascular bundles passes in Haversian canal. You can also see the histological structure. There is, these are concentric ring like structures with central canal. These are called as osteon. Okay, and there is a blackish canal which is called as Haversian canal. Okay, this is Haversian canal, and these concentric lamellas are nothing but lamellas of osteon, also known as Haversian system. And there are osteocytes, these blackish structures, osteocytes, and these osteocytes are nothing but the cells of the bone. Okay, osteocytes have processes, and these processes of osteocytes help in diffusion of metabolites, gases and nutrients. Remember, everything has something, everything has some role in our body. Okay, so these canaliculi, which are the processes of osteocytes, helps in diffusion of metabolites like gases and nutrients. Pay attention to the cells of the cells of Haversian system. It is very important, I am telling you, because these cells, if you remember these cells now, it will be helpful for you to understand many of its functions, their roles in bone formation, bone destruction. There are two kinds of primary cells. One is osteoprogenitor cells. Osteoprogenitor cells means they help for formation, growth of the bone. They contain bone cells, stem cells, and these cells give rise to osteoblasts and osteocytes. Firstly, osteoblasts are immature. They are helpful for bone formation. They secrete organic components of matrix. So याद रखना, osteoblast help for bone formation. ओके, ब्लास्ट हो जाता है और कुछ फॉर्म हो जाता है. रिमेंबर द बिग बैंग थ्योरी कि कुछ ब्लास्ट हो गया एंड द वर्ल्ड स्टार्टेड, द एंटायर यूनिवर्स स्टार्टेड टू डेवलप फ्रॉम इट. ओके, सो ऑस्टियोब्लास्ट हेल्प फॉर फॉर्मेशन. देन ऑस्टियोसाइट्स आर मैच्योर. दे आर ओल्डर वर्जन ऑफ ऑस्टियोब्लास्ट. सो ऑस्टियोसाइट्स जो है दे आर नॉट सेपरेट सेल्स. ओके, ऑस्टियोब्लास्ट ही है जो कि बाद में बूढ़े हो जाते हैं एंड दे डू नॉट फॉर्म, दे असिस्ट इन मेंटेनेंस ऑफ बोन मैट्रिक्स. ओके, याद रखना, ऑस्टियोसाइट्स आर लाइक योर ग्रैंड पेरेंट्स. ओके, एंड ऑस्टियोब्लास्ट आर your parents. Okay, osteoblasts are your parents means they are helpful for bone formation. Parents has undergone reproduction means your parents have reproduced you, and but your older parents have stopped to reproduce. They have the function of maintenance. Now they take care of you, their grandchildren. Okay, osteocytes एक टाइम पे osteoblast हुआ करते थे जिन्होंने रिप्रोड्यूस किया एंड दे गिव राइज टू योर पेरेंट्स. ओके, बट नाउ ऑस्टियोसाइट्स बूढ़े हो गए हैं. दे डोंट रिप्रोड्यूस. दे नर्चर देयर चिल्ड्रन, देयर ग्रैंड चिल्ड्रन. ओके, then osteoclast. What is osteoclast? Osteoclasts are blood cells. They are several multinucleated cells, that is monocytes. Osteocytes क्या है? Osteocytes are monocyte. They are multinucleated. They secrete acids and enzymes to dissolve bone matrix. So osteoclast will secrete acids and enzymes to dissolve bone matrix. Obviously osteoclast का काम है destroy करना. So they have to destroy something. So for to destroy they must contain some dangerous things like acids and enzymes. Okay, you can see this thing. These are osteoclasts. Okay, osteoclasts are big. They have multiple nucleus. है ना, ऑस्टियोक्लास्ट. जो भी ऑस्टियोक्लास्ट मतलब डिस्ट्रॉयर, इट हैज़ टू बी समथिंग, इट हैज़ टू अपीयर बिगर. जो भी विलन होता है दैट इज ही मस्ट बी वेरी स्ट्रॉन्ग एंड ही मस्ट बी वेरी डेंजरस लुकिंग. You can appreciate other cells. So you can see osteoblasts, which are bone formation, these cells, osteoblast, and then osteocytes, something like these. Osteocytes are smaller than osteoblast. Okay, because osteocytes are बूढ़े हो गए हैं. Osteoblast should be bigger than osteocytes. And then osteoclast सबसे बड़े होते हैं because they are dangerous villains. They destroy everything. So osteoclast, these बड़े बड़े cells अगर दिख रहे हैं, so they are osteoclast because they are destroyer. Then छोटे छोटे सेल्स मस्ट बी ऑस्टियोब्लास्ट एंड ऑस्टियोसाइट्स. एंड दोनों में कैसे डिफ्रेंशिएट करोगे? ऑस्टियोब्लास्ट आर बोन फॉर्मिंग, देयरफॉर दे आर समवॉट बिगर देन ऑस्टियोसाइट्स. कि ऑस्टियोब्लास्ट जो है दे आर प्रेजेंट इन चेन्स. एक ही साइड में है सारे ऑस्टियोब्लास्ट, है ना. वेयर एज ऑस्टियोसाइट्स सिंगली प्रेजेंट है, फ्रीली प्रेजेंट है. ऑस्टियोसाइट्स ग्रुप में नहीं है, वेयर एज ऑस्टियोब्लास्ट एक लाइन में प्रेजेंट है ना. A small topic on osteology. I hope you will like it and please subscribe my channel and watch till the end. Thank you.